So let's start with the clinical presentation. So generally speaking, if you see an edematous tender leg in a bedridden patient, you should think of DVT. But you know what? There is not a single sign or symptom that could accurately give us the diagnosis. Sometimes even there are very vague symptoms, and we need to keep in mind the history and the whole clinical scenario. So the clinical findings which make us think that it could be DVT are edema, which is so far considered as the most specific symptom. Pain in the leg. It is very vague, poorly localized kind of pain and occurs in 50% of the patients. Means half of the patients have no pain at all but still have thrombus in their veins. But the tenderness is there in 75% of the patients. Some patients even have redness and warmth over the area of thrombosis. The symptoms of DVT can be unilateral or bilateral, mild or severe. If the thrombus is higher up at the iliac bifurcation or pelvic veins, then edema is usually bilateral. Sometimes there is partial obstruction at a higher level which produces mild bilateral edema that is mistaken as dependent edema or edema of heart failure, hepatic or renal insufficiency. Also remember that sometimes the thrombus dislodges from the calf vein and travels all the way through inferior vena cava into the right heart and then to the pulmonary circulation, and the primary manifestations are that of pulmonary embolism. Nearly 10% of the patients have such presentation. Sometimes it happens that patient has pulmonary embolism and there are no clinical findings in the leg. So it doesn't mean that patient don't have DVT, because autopsy results showed that in 90% of the cases the thrombus was there undetected within deep venous system. I hope the clinical presentation is quite clear now. Let's move on to different other things that have more or less same presentation as DVT. Leg swelling and redness are the symptoms that we encounter very frequently in clinics. And as I told you that DVT has a very vague kind of presentation, so most important thing is that we should look into the whole clinical scenario and keep all the risk factors in mind. And also it is important to consider conditions that have similar presentation like cellulitis, superficial thrombophlebitis, soft tissue injury, arterial insufficiency, heart, liver or renal failure, dependent edema, and Achilles tendinitis. So these are the things that can confuse us while diagnosing deep venous thrombosis. Now in our next section, let's try to understand that how DVT develops.